training and mentorship in their areas of interest. The eligibility criteria is all, here on the RFA and the application process. Most of you, I think, have already sent in your letters of intent. We are going to be extending the deadline. So if you have friends or colleagues who are interested in applying, they can just send us in a letter of intent. The letters of intent are meant to be low stress. Just let us know that you're planning to apply and who your mentoring team is. And you can go ahead and send that in even though the deadline has passed. The application follows the NIH format. And so we have a lot of details on the RFA, and you guys can feel free to dig in and ask us questions. We intentionally follow the NIH format so that if, by chance your proposal isn't accepted into the KL2, your time is not lost, because you can then just flip your application around into the K23 program or any other NIHK, and vice versa. A lot of our scholars go on to apply for NIHKs, and so they can adjust their mentoring plans and research strategies to that format. So the details of the NIHK format, which hopefully most of you are familiar with, including the mentorship plan, are all here on the RFA and on our website, which you can take a look at. We require letters of reference from your collaborators or your contributors or your secondary mentors, a letter from your department chair. All of the information is here. I don't want to read it to you because I'm sure you have better things to do with your time than listen to me read the RFA. The selection process, once the full applications are submitted, they're going to be reviewed by 2 or 3 reviewers, many of whom are part of the CTSI. We try to get broad reviewers based on methods, expertise, and experience with NIH grant review. And we use a NIH grant system and the scoring that you should be familiar with from NIH. If you're not familiar, we can talk about how that scoring happens. The review criteria and all of the NIH language about how we rate the applications are provided here on the RFA and on the website that you can look over, including your mentoring plans. And then the other thing I just want to mention before we dive into questions is really about the focus of the research proposals. The CTSI, as you may or may not know, is a grant in and of itself. And so the CTSI's grant mission is really to advance rural public health and rural health research is the focus of our Penn State CTSI based on where we are in the state of Pennsylvania. And we're one of 6 rural CTSA or CTSIs. And so that's a big thrust. And so proposals that have a focus on rural health or some aspect of rural health will be rated really favorably. So I would encourage all of you to incorporate and think about how you can adjust your research strategy and aims to be addressing an important rural health research project. The rest of the sections follow the NIH guidelines, the women and minorities, all of those things. And then we have a section down here on scholar and mentor expectations and how you might structure your career development plans. So we hope that the document itself is interesting to you and is able to answer a lot of your questions. But I'm just going to stop talking now and open it up to you so that we can ask we can try to answer any questions that you may have.
So LJ, we have 2 questions so far in the Q&A section. The first one is, do we propose a 2-year research strategy for the submission or a 5-year for an NIHK?
That's a really, really great question. So for the KL2, you submit a 2-year research strategy and a 2-year career development plan.
The second question we have is, where could we get this Word form? And actually, if you send me an email, and I'll put my email address in the chat, I can send you the full copy of the RFA.
Just occurred to me, Jessica, I didn't have you introduce yourself. I'm so sorry. Why don't you go ahead and introduce yourself?
That's okay. I'm Jessica Petrie. I am the coordinator for the KL2 program. So I'll be the person that will receive your application or has received your LOI and send it on to LJ and Dr. Boltz for review and the whole process. I also wanted to let everyone know that we are recording the webinar. So we have another question from Rachel. Is the PDF RFA different than what's available on the CTSI website?
No, it's exactly the same. It's just a different format. Unfortunately, the College of Medicine does not allow us to post a PDF or a Word document or any downloads. So we can't post anything downloadable on our website, but like Jessica said, she can just answer.
She can send it.
Yeah.
Sarah asks, the CTSI website has a list of resources that are also available as an example of documents to submit. Can this be sent to us as well?
Can it,
And
Jess?
that's, yeah, if you need an example of any resources, you can reach out to me via email and I can send you those samples. Our next question is, I am interested in an NIHK. Will this KL2 be a shrinked version of NIHK to cover the first 2 years? Is it okay to go with just aim 1 of the 5-year proposal?
Marie, do you want to take that one or?
Will this KL2 be a shrinked version of NIH2? Which is, I would make sure that this is an application and a proposal that is robust enough to position you to submit an R01 at the end. So how you craft it, that should be what is sort of the overarching aim of it. So that's how you should craft it. I wouldn't think of it as a shrinked version of an NIHK, but more as a robust study. And Lauren, do you want to weigh in on this?
I have the same answer as you, Marie. I am someone who, just for context, I submitted my KL2 before I applied for an NIHK. So my KL2 actually ended up being somewhat different from the K I ultimately ended up submitting. And that worked well for me because the project I proposed for the KL2, number one, it has to be doable in those 2 years. But that gives you a lot of opportunity to learn more about whatever subject or whatever topic you're exploring in your KL2. And then that could kind of be like a kangaroo for if you wanted to submit a KO1, a KO8, or a K23 after that. The KL2 could be a kangaroo for that, but it could also be a kangaroo to set you up for your R01. So I like to have all doors open, and that's how I approached it. And I just got a really good score on my K. So it seemed to work out pretty well for me.
Yeah, I agree. And I would just add that, you know, the goal, like Dr. Boltz was saying, the goal is really for you to collect pilot data that will position you for an R01. The metric of success for the program is, you know, can we help scholars get into the R01? And in some cases, people decide to go into the K, into an NIHK. And in some cases, we just had one scholar who just received her first R01. And so it really sort of depends on the state of science, you know, your background. Some scholars have a more robust research background than others. So whether you're going to go for a K or an R next really is an individualized decision. But in your application, you really want to be able to convince your reviewers that in these 2 years, you're going to be able to collect pilot data and receive the training that will make you competitive for an R-level grant. And so if it were me, I would structure the proposal to prepare you for that. And we also know that some people end up going for a K because they decide they need more training or additional years in the K years. So, and that's okay too. Okay, that's okay as well, I should say.
So
Okay.
the issue of mentorship, LJ, I don't know what this question is about, 2 primary mentors and 2 co-secondary. I mean, I think what one has to be careful with is making things more complex than they need to be.
Yeah.
All of us build research teams and have multiple mentors, and the people who support your K, you can name these 4 in a mentorship role, but we suggest that you put in one primary person to be the contact with our program. But that doesn't mean that you wouldn't have, equal weight in terms of their contribution to your research. Do you agree, LJ and Lauren?
I totally agree. And I actually had, when I was in my career development award, I also had 2, they were basically co-primary mentors, and it was really difficult. Politically, it was difficult. So we appreciate that, team science is such that you may have 2 people with equal, that should receive equal credit for, your development and mentoring plans. But we do require that you have one primary mentor, and most mentors are aware of this and should be hopefully okay with that.
Gosh, I would think a department would be really happy to have multiple applications.
Yeah.
I mean, unless there is something explicitly stating by your department that we're only supporting one, but I know there have been multiple applications from one department that have been funded as KL2s.
Agreed. I don't think that there should be any competition within the departments. I think that would be seen very favorably. Can you speak to the possibility of competitive renewal for a 3rd year? Yes, that is tricky, and actually it depends on grant funding. It depends on whether the CTSI is renewed for the upcoming renewal. So for right now, we can only guarantee 2 years, and then the 3rd competitive year will depend on the renewal of the CTSI. So the plan should be for a 2-year K, and the hope is that the CTSI is renewed and all goes well, and we can open up for competitive 3rd years. Generally, the way that works is it's based on productivity, mentor recommendations, and programmatic resources, whether we have enough funding to keep all scholars for all of the years. And so that is a little bit of a tricky issue. I will say that we were able to, all of our scholars who either weren't leaving the institution or had received R01 funding, we were able to give a 3rd competitive year to all of our scholars. But again, this year will be different because we're waiting for the renewal of the CTSI. These are moving here. How likely will I be funded if I don't have a rural component? That will be taken at a large discount. I'm afraid that my time to prepare for the package will be a waste if it isn't competitive without the rural component anyway. So that's a really great question. I think that your proposal will be more competitive if you can make it have a rural component, and it doesn't have to be that it's a rural health research question, but maybe an aim 2 that includes a subgroup analysis looking at the impact of rural living or rurality. Generally, I've yet to see a proposal or a project that couldn't be twisted into some sort of a rural contribution into the field of rural health. So it's not that we're not going to be looking at proposals that don't have a focus on rural health, but it is part of our consideration in funding decisions.
And that, I think the next question, will applications narratives unrelated to rural health outcomes, for example, translational basic science using cell mouse models, be deprioritized in the review process? I think you answered that, LJ. But also you would wonder what the implications, long-term for translation could include rural.
Exactly.
And it would be terrific if you can build that into, your rationale and your scientific premise.
Yeah, I agree. I think if the scientific premise has a rural thrust, then that would be considered. Obviously, if you're in cell models, you're not going to have a rural component, but the problem that you're addressing should be related to rural health or rural health initiatives. Okay, the next one, for a PI with an MD degree, what are the options for RCR course if she's also actively a surgeon? All of the RCR opportunities are included up here. We put them somewhere on the RFA. All of these courses that you see here are available for anyone at Penn State College of Medicine, regardless of degree. So you can just propose that you're going to include those courses or one of those courses that is included in the RCR training as part of your degree. Or I'm sorry, as part of your training plan.
And it can include the SARI courses there.
Yeah, the SARI courses down below. Yeah, that's true. Yeah. Is there a sample document that we could reach to use as a template for facilities and resources, inclusion of women? And yes, we can get you, and Jessica has put her email. So if you are requesting certain examples, we will do our best to track those down for you. The research concierge also has sample proposals that we might draw from. So if you've seen those, they also have lots of examples on there. I think they have that pasted online on the research concierge website. But we'll also try to get those for you as well. Biohazard should align with IBC protocol. I'm not sure what that means. I'm not a biohazard person. Does anybody know the answer to that?
I mean, I don't know the answer to that.
Yeah, I don't know the answer to that either. So we can follow up with you on that one if we could just take a note of that, and I'll find that out if that's should be IRB protocols or IACUP protocols. Can I include a mentor outside Penn State as a co-mentor? Yes, absolutely, but they cannot be primary mentor. The CTSI is an institutional grant, and so the primary mentor does have to be from Penn State. Where you want to take a few?
Oh, yeah, you gave me this rural practicum.
Oh, sorry.
That's okay. For
I
the
can do
rural practicum portion, do we need to incorporate that into our research plan and or career development plan? I would incorporate that into your career development plan.
Yeah, I agree.
Not
You
your
will,
research plan.
yeah, you will definitely get exposure to the rural practicum through the program itself. But if your research is related to rural health, then you need to include some form of training and career development planning or mentorship planning that will help prepare you to accomplish those aims.
And could we also get a sample document successfully accepted for as a human subject document? And yes, you can. So I would email Jessica for that. I'm sort of running away. Oh, does the research need to be interventional in nature, or can it be observational with the goal of eventually conducting intervention work? Yes, it can be observational.
And I'll also just chime in. It's like really hard to get even an observational study off the ground completed in 2 years. You know, I can only imagine it'll be that much harder if you're running an intervention, developing an intervention. Mine is an observational study, and I think a handful of the current KL2 scholars are observational. So if observational is going to be more doable for your 2-year period, prioritize the doability.
Regarding mentorship, what are recommendations on working with mentors from institution outside of Penn State? Yeah, I think we answered that one already, which is that you can absolutely include mentors from outside Penn State, but they need to be secondary mentors, not your primary mentor.
And you, of course, want to make sure that they work well together with your primary mentor. I was a KL2 scholar many, many years ago at another institution, and I had a mentor from another institution that was very strong and collaborated very well with my primary mentor. What do you think, Lauren?
Agree. I think even within the Penn State mentors, it's important to the extent that you can to show that the team has, worked together and are all supportive of one another so that you have a cohesive mentoring team, whether they're internal, external. I agree. Oh, sorry. You might have meant Lauren, like Lauren Forrest, not Lauren. Sorry. Sometimes I answer to Lauren.
That's okay. That's all right. Anything to add, Lauren?
Nope, just ditto. Yes, make sure you work well with your mentorship team as much as possible. You can learn from them. Doesn't have to be like your besties. But yeah, it's really nice when you do have an effective mentorship team, because they're there to help you. And I have benefited a lot from having mentors who, care about my development. So yeah, maybe that's just like an aside. If you can find a mentor who really does care about mentorship and care about lifting you up, it can be a real game changer.
Lauren, do you want to field the last question? Because I think you've heard this theme a lot. If you could take this one.
Are you talking Lauren or LJ?
Lauren Forrest.
Okay.
Yeah, I can have it. Okay, so my impression, can everyone see the questions or can just the hosts see the questions? It's like, I'll err on the side of conservative. I'll read it. Okay, so my impression is that having a rural theme is important. How important is it to emphasize the translational aspect? I can only speak on my experience. And my experience is that it's going to depend on what your application is. So for my study that I proposed, I'm a suicide researcher, and I was proposing to, my KL2 was about incorporating some of the kind of cutting edge methodologies we're using in the field of suicide risk prediction and prevention. But we're applying those in very highly resourced areas. So my KL2 was about, let's take these cutting edge aspects that we're doing in this teeny tiny portion of society, and let's expand them to see if they work well for these underrepresented populations and harder to reach populations. So for my project, I was kind of spinning the translational component of, let's just make sure that what we're doing, what we're studying in these, very neat and shiny kind of privileged areas, do they translate well to more of this real world setting? So I am not a hardcore translational science researcher, but I did pay thought to how can I make the argument that there is some type of translational component? And in my case, that was, do these methods translate in a different population? So I would say try to stick to the RFA as closely as possible and just give some thoughtfulness to the rural part and to the translational part.
Yeah. And remember, the funding source is the Clinical Translational Science Institute. So their mission and charge is to fund translational research. So there's lots of different kinds of translational research, T1 through T4. All that information is on the CTSI website. So most research, I think, well, I should say most clinical research, I think, can fall into the spectrum of translational, but I do think that the translational aspect is important, and it's important to bring that out in your proposal.
So the language. Mm-hmm. Use the language.
Yep. The next question is, as a clarification, do we need letters of reference from collaborators, contributors, and consultants in addition to a separate reference letter? So yeah, it's a little confusing because the NIH uses different language. We tried to keep all the language as similar as possible. So if you look here on the RFA, if you're going to get this PDF document, and this is on the page as well. So we need a letter from your primary mentor, and that's 6 pages. So that's a full plan. And then each of your secondary mentors submits a 1-page letter as well, up to 3. The letter of reference is more from someone who's outside your mentoring team, but is familiar with you, your training interests, qualifications, that kind. It's more of a traditional letter of support. So this may be someone you've collaborated with in the past or has contributed to your work, but is not part of your mentoring team. The mentoring team provides these letters. The letter of reference is more about, you know, your character and potential and grit and those kinds of things. Okay, the next one is, are you able to say how many scholars will be funded in this round? I don't see why not, Marie.
No, it's fine. Yeah.
Yeah,
Go
I mean,
ahead.
we're going to fund 3 scholars in this cycle, and that has to do with the slots that are available on the grant. How would a letter of support from an early stage investigator be viewed? That's a great question. I would prefer to see letters of support from NIH funded faculty or more senior faculty that can attest to your likelihood of developing into a clinician scientist or a physician or research scientist. But I don't know if we have a rule on that. Yeah, Dr.
Yeah.
Yeah.
No, but I would absolutely agree, LJ.
I think there are some like hidden curriculum pieces for like getting NIH funding. And I do think that what this question was just asked as one of those sometimes pieces of that hidden curriculum that a lot of times, at least my experience, my understanding is that when you're trying to get NIH funding or trying to set yourself up to eventually get NIH funding, it is important for the funders to see like, they almost want to see like if we have invested in an investigator, does this investigator who we've invested in, do they believe that this is someone who would be capable of running a trial, executing a grant well? And so it's almost, not exactly like networking, but like if they have invested in someone, they're going to maybe have a little bit more trust in their perspective. Whereas if it's someone like me, who I've not had NIH funding before, like I'm a good researcher, but like they don't know that necessarily. So I do think that there are some benefits to, I guess, yeah, trying to figure out pieces of that hidden curriculum. And in this case, it would be getting letters and forming a mentorship team as much as possible, who have had the types of experiences that you're having and that you're wanting and that you're saying you would get in the future. It can be really helpful if those people have had funding or had some type of track record, documented track record, doing the things that you ultimately say you want to be doing.
Agree. You want your letters to be from people who sort of know what it takes to get to where you're trying to get to. So somebody who can attest to the principles and characteristics that it requires to become an independently funded researcher. Those are the types of folks that you want, you know, vouching for you and going to bat for you and saying, yep, I know that this person can do it and here's why.
Think gravitas. Somebody who carries weight.
Yeah.
So I don't see any questions, but Lauren, would you be willing to share anything that hasn't been asked that maybe folks didn't think about? Here's another one. Is it possible to get feedback on how competitive our application will be based on our letter of intents? No.
No,
It's not possible. I mean, we don't weigh those letter of intents at all in the application process. It just helps us know what the volume's going to be and what the areas are.
Yeah, and it helps us, line up appropriate reviewers. But we rely on peer review for those kinds of decisions.
So other things that might not have been asked.
Do you have sorry, Lauren?
Yeah, sorry. Yeah, I was just,
do you have a sense of how many people will apply for this cycle? Marie, can we say how many letters we've received?
Sure.
I don't see why not. So far, we've received 17 letters of intent, and we're extending the deadline.
We're actually at 18. We got one today.
Okay, sorry.
Yeah.
Thanks, Jess.
So we're at 18.
We're at
Yeah.
18. Yeah.
Right.
But if I could just add though, that just, don't make your decision about whether you're going to apply or not based on numbers. I will say that when I applied for my career development award, which was 10 years ago, a colleague told me, look at the people who are on, I applied for an external career development award, and it was called the Parker B. Francis. And they said, look at the website, and they're all PhDs doing bench research. You don't have a chance of getting it. And I remember thinking, oh, I'm not even going to apply. And my mentor said to me, and this was the best advice I ever got, and I have it on my bulletin board. And he said, you can't get a grant that you don't apply for. And I thought, that's really good advice. And I applied for that grant, and guess what? I got it. And I was the first social scientist in that cohort of scholars who got this career development award. So don't play the numbers. Just apply. If you're thinking about applying and you're writing a K, you should apply, because you never know. There are lots of variables that people may get NIH Ks and who scored above you, and then those slots become open, or lots of things can happen. So if you're thinking about applying, don't sell yourself short. It's my pep talk for you. It's a lot of work, we know that, but it's worth it.
And no grant is wasted, no application, even unfunded ones. The
You
next
can't get a
question
grant
is,
you don't apply for.
right. The next one's for you, Lauren.
yeah, I've been trying to think about it. I have a really bad memory. So it's hard for me to remember. That was about 2 years ago when I submitted it. So I think I'm going to do it 2 first. So there's one question asking if I could share some estimates about how many hours I spent preparing the KL2. I can't, but my situation is probably going to be different than many others, because I submitted the KL2 when I was only like 2 months into my faculty appointment. I joined faculty right as the KL2 announcement was going out in 2021. And so I was just starting at a new institution. I didn't really know, anything. I didn't have existing projects. I didn't have any clinical care. And so my situation was just like, I was learning a new environment, and I was putting together this grant. So I unfortunately can't give you any estimate. I think I worked on it for about 9 weeks. Maybe 10 weeks, but that was basically the entire duration of my faculty appointment at that time. So I can't say how, whether I would have wanted to extend that deadline or not. But I would say when is the application due? June something, or January something, right?
January 19th.
Okay. Yeah. So if you haven't started working, I would definitely.
Yeah, you need to start now.
Yeah. As for things I wish I would have known, I think this is something that I wish I would have known, maybe 2 years ago, is just, and something I'm learning because of LJ and Marie, is in your aims and in your grant proposal, don't be all psychobabbly. I'm a psychologist, so I can say that, but don't try to speak in words that are, I struggle with too much jargon. And Marie and LJ have pointed out to a number of us scholars. And it's so interesting that when we're verbally describing, we're saying stuff that's really compelling, and we're doing that verbally, but that verbal is not what we have written on the page. And the problem with that is that the verbal makes a ton of sense and is super compelling, but the words, the written, is not as compelling, and it's not directly matched to what we're saying. So I would say maybe some, yeah, like grants 101 advice, which is hard to do, but would be to try to reduce jargon as much as possible and like write the way you might speak about it, the way you might justify it to, you know, like your grandma or your neighbor or, you know, someone who's not in your field, because your reviewers probably aren't going to have, you know, they're not going to live in all of the same spheres that you live in. So you need to make it make sense to someone who doesn't have your exact brain or your exact areas of expertise. They're going to do their best to find the reviewers, but, you know, we're also different. Humans are exquisitely complicated and unique. So yeah, try to just write it the way you might speak it in a compelling way. And I think that would help you for your KL2 and it would help you for grants going forward as well.
If the deadline for the LOI is extended, is there any thought of extending the application deadline? No, we're not. We're hoping not to. We're wanting to make sure that those notifications go out with plenty of time for people to make plans. And so we need that time to gather reviewers, get the reviews done, have our study section, all of those things. So our hope is not to extend the deadline. So you should work as if the January 19th deadline stands.
And we also have some requirements or accountability to NIH, where they expect us to get this up and going.
Yeah.
Are there focus on rurality and translational is well noted? Are there any foci on disease outcomes such as cancer, cardiovascular diseases, or mental health? No, there are not. We have a wide range. Obesity, nutrition, dementia care, suicide, no.
Postdoc scholars currently working in Penn State with permanent U.S. residency is eligible. Yes. Yes.
Jessica, do you have anything to add?
Just that, you know, if you have any needs with examples that you would like me to send to you, just please send me an email and I can get those out to you so that you can work on preparing your application. Please pay attention to the deadlines as well, because it is a competition. We want to make sure that we are within our deadlines that we set. It looks like we have 2 more questions popped up.
Yeah. Well, the rural component has to be Pennsylvania. No, it does not have to be Pennsylvania. It just has to be focused on rural health. And is it best to have a primary mentor who is more senior and has received NIH funding in the past? Yes, it is. It is much stronger to have senior mentors who have a track record, not just of NIH funding, but also a track record of having mentored trainees into research independence. Not all mentors have that history. Everyone has to have their first, but if you have 2 that are equally, equally eligible, and this one's trained 5 researchers into R01 independence, and this one's never trained one, I would pick the one with 5. That said, my mentors did not have trainees that had gone on to independence in the past, so it's still possible. So I don't want to sell that short, but definitely more senior mentors that have NIH experience, success getting NIH grants. That's what we're looking for.
And just to piggyback on that, something that I recently learned is that for the KL2, if you can develop a collaborative, close relationship with your mentor, and you can maybe publish some papers during your KL2 time with that mentor, then when you go to apply for your next grant, whether that's a different K, whether that's an R01, if that KL2 mentor is someone who you work well with, you being able to talk about not only your collaborative history with that person, but also that person having the history of running an R01, managing a larger scale grant, that's also going to look better for your R01 because the NIH isn't going to freak out about like, oh my gosh, is this person going to know what to do with a 4 or 5 year award? If you have your KL2 mentor on that grant who has had their own funding history managing larger or longer awards, that's going to help your R01 look better too. So it can be kind of like there can be like some nice downstream positives of having a KL2 mentor who has had NIH funding that can be helpful not only for this, but also for your next grant too.
Okay, in the RFA, it says that a faculty position is required for eligibility, not a postdoc. Are postdocs eligible? So yeah, just to clarify, just actually went into clarification myself. So in the grant, or in the language is that you have to have a faculty position at the time of the award. So if you're a postdoc now, but are going to have a faculty position or have a faculty position, you are eligible to apply. But the faculty position must be in place at the time of the award. If you have specific questions about your circumstances, you can email them to Jess and we can look into them as well, because there's always circumstances. Does the rural health research need to be domestically focused? No, it does not have to be domestically focused. Just rural, public health and rural and translational.
Is it okay to submit something different from LOI? I just realized my LOI project may not be a good fit for this mechanism due to the rural component. If you do not think it is a good fit, I recommend that you resubmit another LOI and get it in soon. What do you think, LJ?
I agree. I think that the LOIs are not being reviewed I don't mean reviewed, they're being read, but they're not being reviewed or scored or graded in any way. And so I would say, yeah, you submitting a second LOI, these are low stress LOIs, and just say, I'd like to withdraw my prior and adjust my research in this way. That will help us to find appropriate reviewers for your proposal.
So mentees are gaining a lot from KL2. What's in it for primary mentors other than the joy of mentoring, and etc.? Well, there is joy in mentoring. There's also satisfaction, not just from the interpersonal aspects, but the sense that you're advancing science. You're helping to advance science. Also, mentors learn a lot when they mentor. It keeps people, refreshed, learning new skills themselves, new perspectives. What do you think, LJ?
I totally agree. A lot of mentors feel it's their obligation to give back. It's part of your sort of charge in academia is to provide mentoring. And also, all my mentors are collaborators and co-investigators on my grants. So, it paid off pretty well for them. They get publications. I worked really hard for them for many years. So, you can make it worth your mentors, your mentors' while.
That's a good point, LJ, about the publications.
Mm-hmm.
Also, you would have tremendous guilt if you didn't mentor, and it would not be good.
Yeah.
The guilt would be bad.
Mentor, yeah. And just to give you, so in our NIH grants, part of the progress report that you do for an RPPR is what training or mentoring opportunities does this research project have? So when I report on my R01, I say, I mentor all these people and they participate in my R01 projects, and you get kudos from the NIH as well. So there's a lot of it. Don't worry about your mentors. They'll be just fine. But it's nice of you to worry about them. We are asked to identify proposal reviewers. What are your recommendations? We do?
I don't recall that.
I don't recall that either. Where if you see that somewhere, let us know where that is. That may be on the. We've read this document a million times. I don't remember. I'm wondering if maybe it's like a fragment that may have remained on from the old website. Please let us know, and we'll change that. We do not ask you to make recommendations for reviewers.
You wouldn't know who to recommend, so we wouldn't ask.
Yeah.
I mean, we don't publish that.
Yeah.
No, we don't. I mean, it's just say, no, don't recommend reviewers. That will be great if we don't. That was communicated to me, so I'll check. Yes. So I think it's safe to say you shouldn't worry about that.
Mm, no. You share a sample of the 6-page training plan written by a primary mentor. Yes, we have an example, and just email Jessica and she'll get you that example.
So we have time for maybe 2 more questions.
There were a lot of really good questions. And if there are any that you need more clarification on, just reach out to Jessica, and she can get us those questions. If we don't know the answer, we will research it and find out for you. Can you recommend any training in the responsible conduct of research? Yes, in the RFA, there are recommendations for courses you can take, and various like online modules or courses. So if you take a look either on the website, or if you want the PDF version, ask Jessica and she will send it to you. Again, we apologize, we can't have the PDF as a download. Talk to your local College of Medicine website team.
These are really good, have been really
Yeah,
good questions.
They have been.
And Lauren, it's wonderful that you came and joined us. Thank you.
Yeah, thank you so much for providing your experience.
Yeah, and Jessica for arranging all this. Thank you.
Yeah, thank you, Lauren. Thank you for coming.
Yeah, I guess I just want to validate whoever asked the question about like, what do your mentors get out of it? Like, that's something I think a lot about too, of like, oh my gosh, I'm asking all these people to be, I give them 0 effort. They get 0 effort on my KL2, they get 0 effort on my K. But it is, it's nice when you have opportunities where you can give back to people who have helped you. So it's my pleasure to be able to be here and chat and give back to some of the people who have helped me.
So thank you, everybody, for joining us.
We do have another Q&A scheduled. Jessica can give the details, but if other burning questions come up, feel free to join us again. When is our next one, Jess?
Our next one is in December at some point. I'm not sure off the top of my head. I'm sorry what date it is. I think it's right in the middle of December, and we'll definitely have that information sent out so that everyone knows when it is. Just a reminder that this was recorded, so we'll post the recording hopefully to our website. I know some of you have asked for the recording, and I'll send that out to you if you have asked for that.
And our question around, are there any resources through the CTSI for review suggestion on the application? As Jessica has said, she's willing to share samples, and that's probably the best form of suggestion.
If you were, if you're engaged in research and getting consultation with CTSI resources, you can always ask those consultants, to look at sections of your grant. They're not part of the program or anything, but those are experts in clinical translational science that you can certainly utilize as well. All right, everybody. Well, have a good evening. Thanks for joining us. And Jessica, thank you.
Yeah, thank you everyone for coming. I'm going to stop the recording.
Thank you. Bye, everybody.
Bye. Thanks, Lauren.
Thanks.
Thanks, Lauren.